Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, endocrinologist and a physician in America. Today on my YouTube channel, I'll be discussing seizures and epilepsy, causes, types, and management. So, seizure happens because of excessive and abnormal discharge of neurons in the brain. Brain is made up of specialized cells, and those cells are called neurons. And the neurons communicate with each other with connections, which are synapses. So these individual neurons, they send signals, and that propagate and take out the functions of the brain. The signals that arise from the brain, from the central nervous system, go to the peripheral nervous system, where the action is performed via motor system, autonomic nervous system, and then the sensations are brought back to the brain. And in the brain, there are excitatory and inhibitory neurons. Excitatory that stimulate, inhibitory that stop. And if there is an imbalance in excitatory and the stimulatory neurons, that would lead to seizures. So that is the most important thing about seizures, is that there is an imbalance in between the excitatory and the inhibitory neurons. There are several triggers to the neuron becoming erratic and causing abnormal discharge of impulses. It could start from a focus, and if it stays focused, it is called a focal seizure. If it arises from one part of the brain and spreads to the other part of the brain, it can become a generalized seizure. And if these seizures happen again and again with a time interval, they are called epilepsy. Most of the times, an isolated seizure would not continue and it will never happen again. However, sometimes they happen again. And what are the factors that actually cause the seizure? So there's a mnemonic called vitamins. V for the vascular reasons, like stroke or hypertension, that can start a seizure. Some people can have a seizure during a stroke. And if the blood pressure is really high, it can affect the brain. It's called hypertensive encephalopathy, which can lead to the seizures. Eclampsia in mothers who are expecting, their blood pressure can rise and cause a seizure as well. Infections of the brain, the meninges that cover the brain, called meningitis, and if there is infection of the brain substance, encephalitis, it can also lead to a seizure. Toxins, different medications like antidepressants, antipsychotics, drug overdose like alcohol withdrawal syndrome can also cause a seizure. So V for vascular, I for infections, T for toxins, A for AV malformations, like sometimes people can have dilated blood vessels, and those blood vessels can irritate the brain, which can lead to abnormal discharge from the neurons, leading to a seizure. Or there could be vasculitis, autoimmune, which could cause inflammation of the blood vessels, affecting the neurons, causing a seizure. Metabolic causes, especially in the neonates, like hypoglycemia, hypernatremia, hypocalcemia. So those calcium is low, sodium is high, or glucose is low, can trigger a seizure. Multiple sclerosis, which is an illness, degenerative disorder in older age, can lead to a seizure. I is idiopathic, or ischemia. Ischemia meaning decreased blood supply to the brain, like in hypoxic ischemic encephalopathy, or cerebral palsy in the children because of the scarring of the brain, damage to the brain, a seizure can be provoked. And those are the seizures which are really, really, really hard to control. Neoplasms or cancers, some people with brain tumors can present with cancers, with seizures. Stress is a trigger to start an epileptic episode. So these are the causes of seizures. The types of seizures could be focal or partial and could be generalized. Focal seizures could be simple partial, which could be just a specific part of the brain which may be stimulated, which could give motor symptoms, olfactory, if it is the olfactory or the smell part, abnormal smells could be present, could be temporal lobe, or there could be psychogenic epilepsy. Sometimes seizures happen when they wake up, or they could be brief episodes. So depending upon visual cortex, so depending upon where is the abnormal focus, wherever it is, it could be focal seizure, and the consciousness is not impaired. Generalized seizure of the so focal seizure, then simple focal or simple partial, and then complex partial, in which there could be the focal or the partial seizure can become generalized, leading to a generalized overstimulation or generalized abnormal discharge of brain neurons, leading to loss of consciousness. So simple partial, partial seizures could be simple, which is localized, complex partial, which could be simple seizures starting from one part of the body, one part of the brain, and spreading to the other part of the brain. The generalized seizures could be, may have an aura. The body would know, that our brain would know that there could be a seizure coming in form of the hallucinations, which could be auditory, could be smell. So those things can happen. So it could be tonics, movement of the body. The whole body stiffens and falls back. So this is called generalized tonic seizure. There could be a clonic seizure, that the whole body shakes. So that is called generalized tonic seizure. Third is atonic, where you lose the tone of the body and you kind of pass out and you fall forward. It's called atonic, which can happen several times in a minute. So the fourth is generalized tonic-clonic, which is the classic epilepsy, in which you may have an aura, you become stiffened, so tonic, and then movement of the body, which is clonic, and followed by a postictal phase in which the body or the brain is confused, which can take few minutes to 10, 15, 20, sometimes 10 minutes, 30 to 60 minutes before the person wakes up. There could be sudden tonic movements of the body and muscle contracts. Myoclonic jerks can also happen. So generalized could be with these kind of grand mal epilepsy. And then there's another type of generalized seizure, which is called absence seizure, in which your eyes are open and suddenly you lose contact with the reality, like you're staring and people are talking to you, you're not responding. That kind of a stare is called absence seizure in French, or absence in English. So meaning you are physically there, but mentally you are not there. It may be a brief episode, which could be triggered by hyperventilation. If you breathe, take deep breaths several times, you can trigger the absence seizure, which is staring attack, like you're looking in the air, not responding, and may last for up to several seconds, and then the person does not remember and regains whatever they are doing, usually no postictal phase. Febrile seizure is another type of seizure which can be present in up to 6 months to 6 years, in which there could be associated with fever. Could be simple febrile seizure if it is less than 5 minutes, happens once in 24 hours, and most of the times it does not happen again. However, if there is a family history, previous brain problems, the seizure can come back. The complex febrile seizure is more than 5 minutes, lasts, and it is a generalized tonic-clonic seizure in which there is movement of the body. You fall, become tonic, then clonic movement, shaking movements, and followed by a postictal phase. And during this tonic-clonic movements, the loss of sphincter, the kids can urinate or they can pass stools. So those are the classic. So complex febrile seizures can last more than 5 minutes, can occur more than once in 24 hours. Those are the classic features of complex febrile seizures. They could last more than 5 minutes, can recur more than once in 24 hours, associated with fever. In the past, it was said that rapid rise in temperature can cause. Not really, it does not happen with rapid rise in temperature. And fever reducers should be given to the children when fever happens, which is a protective response to an inflammation, and sometimes to prevent the brain damage or prevention of conversion of simple febrile to complex febrile. Rectal diazepam is given to the families so that the duration of seizure does not go beyond 5 minutes, which can potentially damage the brain and can lead to chronic seizures. So similarly, occipital epilepsy could have visual symptoms. Temporal lobe may have smell. Rolandic, which starts in the basal ganglia, can have seizures, which can happen in the